Mental reporting is a huge issue for GPs. It's a huge issue for the medical profession. In particular, when we talk about mental health, mental health is a huge issue in the community. And of course, when people have mental health concerns, they're going to see their GP. So if you are an engineer and you have concerns about your mental health, you're going to see your GP because you get confidential and professional advice on how to manage your mental health issues and how to access appropriate treatment. If you are a public servant, and the same thing applies. You go and see your GP as first port of call, and we encourage people to do that, to talk about mental health needs. If you're a politician, of course, you're going to see your GP. Because who is looking after, the doctors who are looking after the communities, who should be able to access healthcare without fear that they're being reported? I think it's just ridiculous. It's not only a concern of the RACGP, it's a concern of United General Practice. That's the organization that is led by the RACGP with members such as the AMA, ACRM, RDAA, the GP supervisors and the GP registrar. So we are all in the same boat because we as clinicians, of course, know that mental health is a huge issue. And doctors and GPs aren't immune, and they deserve to be supported and not reported. And that's our main concern. Am I looking for a nationally consistent approach? Absolutely, because your postcode should not determine those particular issues. I would like to see action now, and I would have liked to see action last year, because it's overdue, and we need to fix this. So we are concerned that people are just ignoring their mental health issues. Then they're trying to self-medicate, trying to make it work, trying to keep things undercover. And this is just not the way how mental health issues are being addressed in the 21st century. And that's why we are concerned that medical practitioners aren't going to seek appropriate advice. So it's not an easy job we have, as medical doctors, in particular not as GPs. And it takes a toll. And we are trying as much as we can, but if it comes to a point where we feel we need to seek professional help, then again that process needs to be supported and the doctor should not be reported.